But there are aspects in a study, there may be aspects in a study that nobody expects. And we wanted to briefly share with you what those unexpected things might be. And another example is, for instance, this one. On the y-axis, you have the echocardiography, the cardiac output in liters, so something between 1.5 liters up to 6.5 liters. And on the x-axis, you have the stroke volume. That is the volume that the heart pumps out with every heartbeat. And usually, the cardiac output and the stroke volume are going hand in hand. They should. At least to a certain extent, depending on the heart rate. But what you see here, for instance, is there are several cases where you have a low cardiac output that is covered by the blue circle, and by the red circle or ellipse, you have the low stroke volume. And you have really sometimes low stroke volumes of around 20 milliliters, 25 milliliters per stroke. And there's one in the left lower corner, very difficult to see, that has something around maybe 15 milliliters per stroke, which is really, really not good. So one may want to focus on those in the left lower corner. And on the other hand, you have on the right upper corner cases where you have 100 milliliters per stroke output and 6.5 liters per minute. Cardiac output, that of course is an indicator that this patient is probably not even sick and doesn't belong into the study, because someone who puts out 6.5 liters seems to be a rather strong young male patient in this case, which is not according to the protocol. So what you can see is the distribution of two data values, data parameters against each other, and then you can make sense out of the data whether that is really what you expect, or whether that is compatible with life, or whether there are any abnormalities, anomalies in the data. That is what CSM can really help you with.